When I was able to start moving again after my surgery in 2019, I had a bucket handle tear. I had surgery. I was able to save my meniscus. They sutured it back down. And after through minor physical therapy at my house, just basically taking my foot and just kind of sliding my leg back and forth because I had a lot of scar tissue after surgery. The first tool I was implementing with was a stationary bike. And the stationary bike was awesome because I could sit down, I could turn it down to no resistance at all and just pedal through and just get some nice range of motion through my legs. So that was a great tool. I'd spend 20 to 30 minutes most days just to get my legs moving and get that range of motion back. When I tore my knee again in 2022, I hopped right back on that bike and started utilizing that again. I had a few weeks of swelling and pain with movement, but then the swelling and pain went away and I was able to get on a bike again. See, I'm a big fan of the stationary bike because the stationary bike is something that can be low resistance. It can help you straighten and bend your leg over and over again, and you can get a lot of volume of repetitions in. So it's a great way to strengthen the knee and to help the knee heal, to facilitate the natural body's healing mechanisms. So my recommendations for you is a few here. One, you don't have to. I have links in the recommended equipment for you to buy a stationary bike or even a treadmill. You don't have to do those things. Now, if you've got the funds and you can do it, by all means. But if you can get yourself to a gym or you have a friend that has one and you can borrow one, or you already have one, which would be, a win-win, test it out. I don't know a ton of people that have pain with riding a bike, but there are a few cases that I've experienced with people I've worked with. But riding a bike didn't feel good right off the bat. So we needed to do other things to help them facilitate their healing and strengthening before they could hop on a bike. Things in this course can do that for you. So if you can't get on a bike or you don't have access to a bike, I recommend at least experimenting and finding a friend and see if you can borrow one. Now, outdoor riding is going to be a little bit different because you can't change your hills or the downhills or what you have access to. But if you can get on a bike outside, I recommend starting off on flat ground or even a little bit of a downhill. Because at least on a downhill, you're not going to have to push too hard with your leg to get yourself to move. But you can still get those repetitions, as your leg is moving through that. So another thing with the stationary bike is to make sure that you're in a good position, making sure that you're not too far forward so your knees are coming too far over your foot, and making sure that you're not too far back so that you're having to lean way too far over to be in that position. You want to be in a comfortable position. And generally what I do is when I stand next to a stationary bike, I make sure that the seat post is hitting me right by my pelvis, right by my hip bone there. That's generally a good spot. And then I want to be in a position where my arms are here. I can lean forward a little bit, but it's not too strenuous. Think of being able to be in that position for 20 to 30 minutes consistently. You want to be comfortable. You don't want to be hurting. So that's a little bit of my story about a stationary bike. It's something that I use consistently now in my own schedule, my own workout routines. It's something that I do probably 3 to 5 times a week. I'll hop on for 20 minutes at least, generally at the end of my workouts. And a lot of the content in this course, those are things that I utilize in my own personal workouts. I utilize a lot of these elements, the myofascial release, the mobility drills, the activation drills, as warm-up exercises before I move into a weightlifting circuit. And the weightlifting circuit is also something I do to utilize the strategies I know to help facilitate my body getting stronger and also healing. I want to be confident in my body and I want to be confident in my abilities. So those are my tips in regards to riding a bike, a little bit of my story. Biking can be just such a great tool for repetitions, like the walking. We talked about walking in the last little module there. Walking is another tool that can be great for volume. And volume is what we're looking for when we do something. A lot of repetitions. So if you can get your hands on a bike or you already have access to one, great. But experiment with it. Hopefully it doesn't bother you. And hopefully you can get on a bike and start utilizing this tool to help facilitate your strengthening and healing.